have set aside some time towards the end where we're hoping to have a Q&A session. But as we're going along, please do feel free to use the chat function. So if you have thoughts or comments, or if you have questions that you think of while the presenters are speaking, please do drop those in the chat and we'll endeavour to answer those towards the end. Okay, but now I'd like to introduce our speakers, and I'm going to start with an introduction to Dr. Anna Winters. So Dr. Winters trained as a spatial epidemiologist during her master's and PhD programs and at the CDC Division of Vector-Borne Infectious Diseases. So she co-founded Akros, which provides technical support for disease surveillance and response systems to ministries of health all across the global south. So Anna's interest, and really what we're here to listen to today, is in applying the power of spatial intelligence to optimize health interventions, bringing impact and more equitable health service delivery to that very last mile. I'm also happy to introduce Mr. Derek Pollard, who is a monitoring and evaluation specialist with over 10 years of experience in designing surveillance systems and leading mobile technology design teams to expand data access and data consumption across LMICs. Derek has led the functional scoping of the Reveal product, and he oversees multiple implementations of this platform, working hand in hand with a number of different government agencies. Ms. Mercy Odhiambo provides technical oversight to the Kenyan Ministry of Health and various stakeholders in the implementation of geo-enabled digital microplanning tools. She is a program manager for Akros in Kenya, and she's been leading the Reveal deployment there. We're also very happy to have with us Mr. Francis Mutoka from the Ministry of Health in Zambia, who is the IRS manager and national IRS trainer. And last but certainly not least, we have Mr. Amadou Fall, who is a technical advisor for health management information systems and digital governance for Digital Square. He's based in Dakar, where he leads the community health digitalization efforts within Senegal, also providing support to Burkina Faso. And Amadou's been involved in implementing several tools for malaria case management and campaign digitalization, using tools such as Reveal. And now I'm going to hand you over to our very first speaker. So over to you, Anna.
Great, thank you so much, Linda, and everyone. We're so happy that you've joined us today. Digital Square, thank you for putting this great series of webinars together. We're really honored to kick this off. So today we'd like to keep our talking to minimum so that we can have some Q&A. So all presenters, if you can aim to keep at time, that would be lovely. Before we get to the tech content, I really wanted to take a moment to ground this discussion in real life, and that is the realities of the type of communities that we've been working in, that really the thinking that has informed the development of the Reveal approach and platform has come from. So let's begin here. This is Chipo, and she's rushing home from school in her small village in Zambia, in Choma district, where a number of our attendees are actually joining us from. Chipo's rushing because she has so much to do before the sun is setting. She's veering off the road onto a very small footpath through the maize fields on her way home. She reaches home, and there she calls out to her grandmother, Agnes, and her great-grandmother, Martha. And both are there. They're sitting under a tree on some old feed bags there in the family compound. And you can see some of those pictures of this family in Choma. Now, both of these grandmothers respond by clapping their hands, by smiling, by giving their traditional greeting there in Zambia's southern province. And the situation here is both of Chipo's grandmothers are blind and have been for decades. Their loss of sight is not the result of old age necessarily, but a bacterial infection called trachoma. And being blind in a place like the villages of Zambia truly renders a person helpless. So it's fallen to Chipo here to help her elders function. So many days, Chipo actually has to stay home from school to help her grandparents through the day. So just a little bit about trachoma. It's the world's leading cause of infectious blindness. It's still a major health problem. It's largely causes irreversible blindness, yet it's very treatable. And large health campaigns, typically mass drug administration, is used to provide antibiotics to treat trachoma. So that really brings us to the challenge of how to deliver these campaigns, how to reach the unreached, how to know that these services have been delivered. And often one of the key challenges is that we don't know where these populations are. They're maybe unmapped. We're looking at old survey data. Roads might be cut off during the rainy seasons. And what happens is that these challenges often play out in what we see on the ground, and that is low campaign coverage. That could be for NTDs like trachoma or indoor residual spray for malaria. So you hear about some of that today from Zambia, Kenya, and also Senegal, about how the good news of using Earth observation data such as satellite imagery and putting that in the hands of district planners and field teams so that they can understand where populations are and they can actually navigate to those households and communities to deliver life-saving interventions. This has been a game changer, and that's what we want to share with you today. What we've been learning, what has worked, what hasn't worked, that's some of what you'll hear. Just a quick mention about Akros. I'm a co-founder and the lead at Akros. We have been involved in a number of countries across the global south to build and deploy surveillance systems and interventions to ensure that they're reaching the last mile. We're a woman-owned business. Our roots have been in the global south with both an NGO based in Zambia and also a US-based entity. So let's just jump into the Reveal work. Just a very quick overview, and then I'm going to hand it over to Derek to lead out here. But Reveal really is a platform that can be thought of in three different parts. The first, supporting microplanning, where we're using satellite imagery and other map layers to understand population distribution. The second piece is putting that base map into the hands of field teams through a mobile application. And the third piece here, you can see on the right hand of the slide, dashboards that can be used to monitor the coverage and areas that need further focus during health campaigns. The platform has been deployed across many areas in the global south and to support a number of interventions that you can see listed there on the left. Derek, can I hand this over to you?
Thank you, Anna. So we're going to go through a use case from Zambia. If you could go to the next slide, Anna. So just as a summary before I get into the meat of the presentation and into the weeds of the Zambia scenario, I'll be talking about the Zambia IRS use case, where we've also implemented in Angola and Senegal. So what did we do exactly in Zambia? We replicated the three-step approach that Anna spoke to about earlier. The first being use of paper and digital maps to support microplanning. The second being field teams that navigate to and deliver IRS to all targeted structures using the Reveal mobile application and give them the ability to evaluate progress offline. Thirdly is the data that is used for responsive decisions to maximize impact for IRS. And lastly, we use that data that granular level data for post-season analysis to help inform policy. So some of the results are that we're seeing is that there's an improved understanding of gaps in campaign delivery, improved coverage per settlement visited, which basically results in bang for buck. And some of the next steps we're looking to do, which I'll talk about at the end, is looking to digitize the micro-planning process and achieve end-to-end campaign setup by the end user. Next slide, Anna, if you could go back to the slides. Anna. Thanks, Anna. Could you put into presentation mode? Okay, so the first step I'm going to talk you through is the planning process, and we do this in two different ways. The first way is using paper-based maps and satellite-derived data to create these population and residential structure distribution maps across a district. And so we're looking at a district in Southern Province where we've mapped all the health facilities with the health facility teams and put settlements on those maps, attributing a population and structure count to each settlement. And what that does is allows the planning teams to be able to see a total population and a total structure count per health facility. Next slide. As they go into this planning process, we often bring in historical data from previous campaigns, where here you can see areas in red that were not targeted the year before and areas in green that were targeted the year before. And so they can use that data to help understand where they're going to target this year. Next slide. Likewise, we use the actual IRS data. So all these dots are structure points, and you can see the yellow structures were not sprayed and the green structures were sprayed. So it gives you an indication of where did they target versus where did they actually go into the field, and therefore how should I change my plan going into the next year. Next slide. This is a result of the paper planning process where they're demarcating which vector control activities will go where. So here they've demarcated where they're going to distribute nets versus where they're going to distribute IRS. Next. And as an output from that, we can see these areas that have been targeted for IRS, and those areas get pushed into the mobile client to support the field teams doing data collection in those areas only. Next. So likewise, the planning process can be done online. This is still a work in progress for Reveal, but the purpose of the online planning tool is to be able to compare campaign targeted areas to available resources, to strategize how to maximize your impact through the use of these geospatial tools. And then once you've selected areas within your plan, you disseminate that final plan to your field teams for them to start data collection. And so what this looks like is in this slide here, you can see the team going through the process of selecting settlement level locations to include within their plan. And these settlement locations were available on openly available data sets online, as well as data sets that Akros had created. Next slide.
Sorry, just to interrupt, Derek, that's your 1 minute warning.
Okay, if you could move on to the next slide, Anna, and the next. So a quick view of the mobile tool. Once the plans are delivered to submitted to the teams in the field log in, navigate to structures, as you can see in the middle slide here, where they can only select a structure that they are that they are right next to. In addition, they can view their indicators while they're offline by syncing their data between devices in the field. Next slide. The Reveal mobile application can also be used at village level and not just settlement level, where you're collecting village level data collection. And then we go on to the third stage, where we're looking at the dashboards to encourage decisions for impact. So here we can see which settlements have been visited in green and which ones have not in yellow. And likewise, at settlement level, we can see which structures have been visited in green and which ones have not been visited in yellow. So the whole purpose of what we're trying to achieve here is to ensure that no one is missed and put the decision in the hands of field teams. And so you can see by this yellow circle and the red circle that they both highlight areas that have either been missed by the field teams or where we've got high refusals. And so concentrate the response decisions around that data. Next. The literature has shown Reveal to have both increased coverage impacts and a reduction in cost per case averted. And there's a number of literatures that you can look at after this presentation to understand that more. So I'm going to hand over to the Luanshya District Manager, Francis Matoka, who we're working with in Copperbelt District. This is a picture of Copperbelt. And as you go to the next slides, we zoom in through the Reveal application to see Luanshya District and the health facilities that were targeted. These are the spray areas that the teams in the field right now are spraying. And if we look at the next two slides, we can see spray area level progress, green being visited, red being not visited. And so with that, I am going to hand over to Francis. Francis, if you could give us some very brief insights into the challenges and benefits that you've seen from implementing the Reveal tool in Luanshya.
Thank you, Tim. Thank you, Derek. Good afternoon, everyone. This is Luanshya. This is IRS Manager for Luanshya, Francis Matoka. Just like Derek has mentioned, with Reveal, we've been able to get very good insight of what's supposed to be done on the ground. In an event, for instance, we planned to do 22,000 structures, but finally with Reveal, we're able to get the precise number of structures that are habitable and where the impact will be if you're going to spray compared to the other that we'll be able to plan with. So before I even go through this, I would prefer using this review, I would want us even to use this information that we have now to use it for planning purposes for next year, 2023, that we're able to achieve the best target that we're going to attain by this time. So the few challenges that we've had with review, so we're using the phones, the tablets, and at times by the time we start a campaign in the morning, we get in the afternoons of the campaign, the batteries run low on the phones. So with the geolocation where you don't have electricity to recharge the batteries, it becomes difficult to recapture all the structures that are in the spray area. So it limits a bit of some time, but I think we need to add more to that. High refusals is not per se an issue to do with the review, but it's positive on our end. We're able to identify structures that are not able to be ready for IRS, or maybe they've just dropped out. So with review, we're able to identify and able to plan very well, so that when the health promotion team, which is going to target people of refuse, people at the lockout who had the missed chance, are able to be visited with a very straightforward direction in terms of approach, because you're not going to go in the whole spray catchment area to find out where did the house, which house was sprayed, who didn't have the house sprayed, because the review is able to show you everything at the same point in time, like say this one was sprayed or this one was not sprayed. So to us, has added value in terms of technique, in terms of approach, and the effectiveness in terms of how we are going to administer the IRS vis-a-vis the cost implication at it, because you have to travel a distance, burning fuel, all those costs. So you have to plan with reviews more specific and in terms of what you're going to find and you're able to get. So to us, it has been a very good plan for us to achieve what we've been able to see so far. And it's also been able to assist us in terms of planning, deployment of people. People we call mobilizers, people that go before the team, and people that go with the team during the actual day of spraying, and people that will go still with the team that will go and talk to people about the IRS program in terms of what they want to understand. And in case they refuse, they wanted to reject it, so that they understand and be able to understand that it's a global process, it's a community problem, so that they'll be able to understand one another and be able to cover the whole catchment area. The biggest issue that we'll be able to achieve is we'll be able to understand every catchment area we spray, is that we'd look at the catchment, the spray areas, how many of them have we hit the 90%? Can we say this catchment area is protected? So it adds value to our planning purposes to simply say, okay, fine, here we've done very poorly. I think we can reserve our energies to spray this area and this particular area, adding to the instance of that particular catchment area. If the instance is so high, we'd rather spend more resources with the support of review, giving us this information, we'll go into a catchment area, spend more resources on community mobilization and have houses sprayed and reduce the impact of malaria. That particular geolocation and be able to win numbers. I submit.
Thank you very much, Francis. So in the interest of time, I'll just highlight 2 points here. One of the main things we're looking to do is to maximize IRS impact through the field teams needing to make daily decisions on whether a village has actually reached 90% or not. So we're focusing the decision at village level on a daily basis. Another highlight here is one of the goals that we're trying to achieve is end-to-end campaign management by the end user, and we still have some work to do as discussed earlier. And the last point is looking to take the micro-planning process online through Reveal and increasing efficiencies by replacing the paper-based and Excel planning tools that typically get used even alongside the planning maps. Thank you very much. Back to you.
Thank you, Derek. I think I'm going to speak about Senegal. Yeah, in Senegal, we've used Reveal in 2021 for IRS, and it was a great experience. We had it used in the 4 different districts in the northern Senegal. We started the work with the Akros team on by doing the mapping of the structure within the districts, and we end up and then we had that we had some maps in the first year in 2020. The maps Akros maps was Reveal maps was used for IRS planning, which we use another tool, and we continue the planning in the 4th district before using it on 2020. And during that implementation for IRS digitalization, the campaign, we had 69,000 submissions that were data that was collected through the structure that was enumerated. And we also, their dashboard was used at all levels, at the district, at the regional and the national level, to see the data in a real-time base. Next slide, please. Next slide. I think that's the same slide. So here is the map that I was talking about. This is the map of the Akane district, which is in the northern Senegal, as you can see in the map down at the bottom. So in here we can see the map is showing the enumeration of the structure, and the green is showing the settlements that have more than 10 structure. And the red is showing the settlement that has less than 10 structure, and this helps a lot to define and to better do the micro planning, to do the planning for how the IRS will be organized. And as you can see, in Senegal, which one thing is really important is the health facility boundaries. So we did I would say pre-campaign work with Akros team to draw the lines of each health facility, because that's the approach of the country. So here we can see in details. Next slide, please. And the approach that we use, in the middle, you can see a lady showing her phones that she used for iris, and that was revealed on the phone. And what we have done is, for each spraying team, we integrate one enumerator. So they were the one guiding the operation, the spraying team, saying that, okay, this is the way to go, using the map, offline map, because this area is very wide. This is the widest in terms of network coverage in Senegal. But we use Reveal in there, and the maps was working fairly, was working good in this area. And on the mobile phone, this is what we can see. You see these yellow points that shows the structure that was not visited yet. And as Derek was saying, the much amazing things with Reveal was in terms of data quality, I would say, because the enumerator were not able to open the form if they are not close to the structure, which was amazing. So there is no possibility to cheat, if I can say so. So in the middle, you can see the form, which is very integrated with a lot of skip logics, which improve and increase the quality of the data collection. Next slide, please. Yeah, and in here, as I was saying, in a real-time base, the national, the regional, and the district level, and even the health facility level, they can see, as they are going in the campaign, how the people are evaluating. So in here, you have 3 different colors. The green is showing the structure that was already sprayed, completed. The yellow was not visited. The red was not sprayed for any reason, that was captured as well. And the black one is showing the building that was enumerated as a structure, but was not eligible. So that will be taken off to the denominator. So that was amazing as well. In the real-time rate that we showing that. So in here, we have another example of the completeness. And you can see on 68, there was 68 structure that was visited under the 73 that was initially targeted. So, and here are some results as well. You can see in this area, which is the district of Canal, it was not all the health posts that was covered, that was targeting in this campaign. So that's why we see some blank on some field, but those fields that was targeted, that was visited, you can see the coverage in here, in some results.
Sorry, Amadou, there's your 1 minute warning.
All right, so I will just, can you go back to this one? Yeah, so this one is showing this is really important, because we conducted IRIS before in 2020, and this is showing the gray is showing the structure that was not visited. So it was a very high impact on this campaign, because this was showing that we were conducting IRIS, but the review shows that we were missing some areas, some structure, some villages that was not visited. So this was very important in terms of analysis. Next slide. And in here you can see in the 4 districts, so the gray is showing the non-targeted, but for the targeted one, you can see the black is showing the targeted that was not visited, and the red is showing the targeted not sprayed, and the gray that showed how many of the targeted was sprayed as well. Next slide. So as well as in this map, you can see for the next campaign, maybe we can better address our targeting, because this is showing that we targeted a lot that was not visited, and that's break down the indicator of coverage. So that will help for next slide, please. I know I'm over time, and I will just end up by saying that Reveal, compared to the other tool that we use, Reveal shows a lot of positive things, because that show the real coverage. Because the other campaign we go with other tools that doesn't show what was the reality of the ground, but it will show the reality of the ground. And but that's what we've learned for this campaign. I will end it here. Thank you.
All right, thank you very much, Amadou. My name is Masio Gambo. I'll be sharing with you some highlights of the work that we're doing in Kenya, supporting the Ministry of Health, the neglected tropical diseases in their goal to eliminate soil-transmitted helminths and schistosomiasis. So in Kenya, we have supported the division of neglected tropical diseases in digital microplanning and the implementation of Reveal for real-time MDA data collection and coverage monitoring. These innovations have helped improve the allocation of MDA resources, improve access to real-time data for decision-making, and improved overall efficiencies during MDA. Next slide, please. The Breaking Transmission Strategy reflects on the commitment of the Kenya government in achieving the goals towards the prevention of the control and elimination of 4 preventive chemotherapy NTDs. So that's STH, soil-transmitted helminths, schistosomiasis, lymphatic filariasis, and trachoma. And the goal is to reduce the prevalence and intensity by 2030. Community distribution is key in this quest, and having a hybrid approach that's a mix of house-to-house distribution and fixed point distribution is critical for us to be able to achieve this. Next slide, please. So Akros basically adopted the 6 steps that you're seeing in the image from the WHO guidelines for microplanning to create innovative digital microplanning solutions. We used grid 3 maps and created each ward map to improve the coverage and reach through a better understanding of the size and distribution of the target population and the burden of disease. Previously in Kenya, we did not use the maps to plan for the campaigns. It was simple distribution of resources against population, but there were critical elements in the geographic factors that were being missed out in the process, and this is what we help to highlight. So Akros realigned the microplanning process to improve decision-making at all levels. We took into consideration the resource ceilings at the national level, as well as other geographic considerations that are unique for each implementation unit at the sub-national level. So our digital microplanning solution has a sliding scale. This basically guides the implementing teams to effectively plan to achieve both therapeutic and geographic coverage using both population and geospatial data. Next slide, please. Reveal was used to collect real-time MDA data. We piloted bring your own device implementation in one sub-county and found that the CDD supervisors were able to use their smartphones and enter data just as well as the other teams that were using phones that we provided. And the CDD supervisors were motivated to check their quality of data. They're keen to check if their totals added up, and they could confidently respond to any queries regarding the mass drug administration data during the MDA. And we found that they were able to, this helped them with accountability of data and improved supervision as well. And the live maps offered more support for social mobilization, because now they're able to see the road networks, they're able to see the distribution of the households to effectively plan how they're going to target each and every bit of the population that needs to be covered. Next slide, please. So in essence, Reveal improved the MDA monitoring by task shifting the daily data entry to the supervisors. This improved the timeliness. We're now able to get the data much faster compared to the previous process, where we would have to wait for the data to go to the HRIOs, and then the HRIOs compile and then disseminate that information. It improved accuracy because we're able to correct, as you're seeing there on that image, these are CDD supervisors comparing the paper records and correcting on the app. And we're able to support the sub-county teams to provide real-time data to support any mid-reallocation decisions that needed to be made to help avert any possible stockouts. We all understand that these health campaigns happen for a very short period. That's like 5 days for mass drug administration campaigns. Therefore, we need to be very effective and to respond to any emergencies as fast as possible. And Reveal definitely came through for the teams that were out there implementing this health campaign. It also improved the supervision of the CDD performance. The CDD supervisors could now look at their teams, understand how they are performing, and pinpoint the particular areas that needed more supervision. And also the color coding helped track the progress over time, and also came in very handy in terms of supervision support. So I'll now hand over to Anna, who will take us through the vision we have for Reveal and our future plans. Thank you very much.
Thank you, Mercy, and everyone for the fantastic information. I'm just going to take about 3 to 4 minutes to close us off and then turn us over to the Q&A. So if everyone can be thinking about the questions you may have, this is a fantastic opportunity to really get some good information from the people on the ground who have really been absolutely key to this learning journey. So the vision that we see as we continue down this Reveal pathway is that spatial data are absolutely key to both plan and track service delivery. And I think you've seen how this has been so important in Senegal, in Kenya, in Zambia, and in the other countries where Reveal has been deployed, and how we can start moving towards using this type of approach in an integrated fashion. You may remember the list of interventions that Reveal has supported. We see a vision where those interventions can be integrated on top of a spatial database, such as Reveal. So that's a real focus here. We also see the opportunity to continue to extend the value chain. The type of data, the granularity of these data has such value to improve global population data sets. I want to share a concept note with all of you in one of the last slides about that. And then also we see this opportunity for the Reveal community to keep growing. Reveal is an open source digital global good. We want to see additional implementing partners, governments, local software developers getting into this platform in the code to really be able to scale this in other areas. Here's just a snapshot of some of the community members, thought partners, etc., and a note here about the steering committee and technical committee that have come around Reveal. And just a couple of points here on the roadmap. This has been a learning journey of how to build spatial intelligence and how to utilize this type of approach and put the power of spatial data in the hands of field teams, community health workers, etc. As we move into 2023, some of the areas that we continue to see as important on this roadmap, you see listed. Reveal will be available on Google Play, thanks to an investment by Digital Square. We're also aiming to do some improvements on the UX within the maps. Derek mentioned more work on the micro planning. We want to build the opportunities for integration. DHIS2 is one of those. So lots of exciting opportunities here as we look towards the future of the roadmap. And I mentioned this idea about extending the value chain. We have recently developed a concept note with RAMP. If you're not familiar with RAMP, this is a product that Dev Global is building. If you are interested in reading this concept note, and providing your feedback, we would be keen to receive this. Again, this idea is to extend the value chain of these field-based data to ever and always continue to validate and improve global population data sets. You can get that on the Reveal website, revealprecision.com. So just a very short last call to action here. I hope that what you're hearing here is this has been a learning journey. It hasn't been all perfect. but we really are making some significant progress here. We've demonstrated some impact in campaign planning and delivery. There's opportunity to build integrated campaign moving forward. We've seen some multiple countries and their implementing partners wanting to see Reveal scaled. Some of the barrier to accessibility has been a lack of core funding to maintain the code base. And if we can change that through some level of core investment, that will aim to drop the costs and eliminate some of these deployment barriers. So just some contact information there and a link to the latest Reveal newsletter where you can read more about the ongoing deployments and some of the things we're learning from the field. So again, thanks to all of our partners. Thanks to everybody who's shared here about their work on the ground with Reveal. And with that, I'm going to turn it back over to Linda, Maria, and Sophie for about 15 minutes for Q&A.
Great. Okay, thank you so much, Anna, and to all of our presenters for a really interesting presentation. We don't have any questions in the chat so far, but I do want to just pause and participants here if they have a question. Okay, I do have a few questions of my own that I'd actually like to pose. And the first one actually, and maybe I'll ask Mercy if you could maybe address this, but what I'd like to know is sort of knowing what you know now, given your experience, what is the one piece of advice that you would give to people beginning or starting out on an implementation of a tool of this, any sort of digital technology tool?
Yeah, thank you for that question, Linda. One piece of advice I'd love to give is to make sure you have all the stakeholders on board from the very beginning. We understand digital solutions are very resource intensive and they're hard questions to be answered. Where you're getting resourcing for devices, where you're getting resources for training, where you're getting resources for scaling, and what considerations do we have in terms of governance, data protection? Are all these in line with the strategic vision of your stakeholders? So having all these people work with you from the very first step is very critical towards the success of the actual implementation. So it also helps to institutionalize once you're beginning with the end in mind, so that as you're implementing, you're training the people who are going to actually carry on the work even after the donors leave, even as you're building the capacity, you're building that resource pool over time. These are the very people who will carry on the work after the donors leave. So begin with the end in mind, have everyone on the table, and have the hard discussions from the very beginning. Thank you.
Okay, great. Thank you so much. And I'm glad you used that phrase, but begin with the end in mind, look into the sustainability of these solutions once they've been implemented. Just a reminder to everyone on this call, if you don't want to speak up, please do use the chat and drop your questions in there. I know I'm rather hogging the space, but I do have another couple of questions. Both of them actually are around integration. And maybe I could ask Derek to expand, or Anna, to expand a little bit more on, first of all, on the technical integration, because I did notice that you had that on your roadmap for 2023. Can you maybe tell us a little bit more about that?
Thanks, Linda. I'll speak briefly about the experience in Zambia and what we're trying to achieve, and then I'll hand over to Anna to talk a little bit about the vision of integration going down the line. So in Zambia, we don't have full integration with DHIS2, which is probably one of our priority integrations to achieve. But we do have CSV downloads in a uploadable DHIS2 format that we download on a weekly basis from Reveal and upload into DHIS2. and that's done by the field management teams. So over to you, Anna, to talk about the vision. Anna, can you hear us?
Pause there. Yeah. So thank you for that question. You know, like Derek said, one of the keys here is being able to push these data that are gathered during these campaigns to the health management information system. Typically, those data will be needing to be aggregated in order to push into, say, DHIS2, but currently there's an export and then import process. We want to move that to a more direct integration. I'm actually going to ask Lavashan Subramuni, who's the technical product manager, to talk a little bit about FHIR and some of the integration opportunities that we see as well. Liv?
Thank you, Anna. That was a great question, Linda. So it's really high. It's been really high on our roadmap for quite a few number of years now. So let's just talk very briefly about DHIS2, and I'll speak about the FHIR API that we built out a second or two. So the proposed DHIS2 integration is actually quite interesting and quite powerful in the years to come. What we really want to do here is build a solution to map entities to basically any DHIS2 instance around the world. DHIS2 can be deployed pretty much anywhere in the world, and also elements from one DHIS2 instance can defer to another instance. So in order to build a sustainable integration, we need a utility or configuration tool to help map entities between Reveal and DHIS2. We've already engaged with the University of Oslo, and I think they have bought into the idea and have certainly agreed that the design that we have in mind would work well going forward, and also the current implementations of Reveal. In the last year, sorry, to fall back on the previous question, in the last year, we actually built out a FHIR standard API to allow for the distribution of data across multiple platforms. So if any FHIR native or FHIR standard type applications would like to consume data from Reveal, we have this already exposed natively without any addition to the code base. So that's already one feather in the cap, I think, for Reveal.
Great, thank you so much. I see all of a sudden we've got quite a few questions, and sorry, first of all, I believe, Francis, I missed your hand up. Do you have something that you wanted to add or ask?
Yeah, please, it's not really a question, but just to contribute and a positive way. Kudos goes to Derek for this, and we'd like to appreciate very much more for the service that was done in terms of our planning and how things are going so far. We are more being systematic, and I feel we can do more with Review, and to actually be able to help us much more do planning concerning how much resources we need. So like now, looking into 2023, what we are spending in the catchment area this year compared to next year, I think there will be a lot of resource saving, and I feel we'll be able to channel it in the other direction. And going forward, the plan that we have as a district is to have what we call community IRS, addressing issues of refusals and the lockouts. But I think when we go into that kind of direction with that community approach of IRS with Review at hand, it will be much more easier because we'll be able to know how far SOPs will move from the particular site to spray area and that area, and be able to plan very well with our transport, how much we need and stuff like that. So there's a lot more that I would want to share, but I think it has added more value. That's my contribution I wanted to make.
Great, thank you very much, Francis. And moving on to the next question that we have, which is from Awesome. I'd like to understand how easy it is to reuse readily available spatial data or digital maps. Interesting question.
I can answer that, well, some of that, and Anna, you can fill in any gaps, but what would be interesting, Anna, I think this addresses this question and 1, 3 the third question down the line. If you could go to slide 31. In Luanshya district, for the first time, we actually used the Google footprints. We cleaned the openly available Google footprints. Google released building footprints across Africa in 2021, and then again this year in August 2022. We used those footprints, cleaned them, and that's the date. Those are the footprints that you're seeing on this map here. So as opposed to having to conduct enumeration, manual enumeration with people digitizing the boundaries of each structure, we've been able to just access openly available building footprint data sets as a starting point. In terms of other digitized data that we use at the end of the season, we download all the data against these building footprints, and we reuse that data for planning in the following years. And so through the first year of implementation, you're kind of adjusting the structure counts on the ground, and you're getting field verified data that then becomes your most accurate data set in planning the following year, which I think Francis was also talking about. In addition, in the planning module, we attribute certain data sets like disease burden, any historical data, any data that's pulled from DHIS2 that looks at disease burden levels, or at any risk modeled data. We attribute that to settlement level, to health facility level and district level during the planning process in order to facilitate prioritized targeting to maximize the impact of the resources that you have in hand. That's it. Thanks for the question.
Right. Thank you very much. And one more question here from Casey. Has the Reveal tool been used in HIV treatment care in any use cases?
That's such a great question, Casey. This is an area that we see as a real potential for a use case, but Reveal has not to date been used for HIV prevention. One of the challenges that we see is going to be privacy. And so that is one thing that I think we would need to think about addressing. There is thinking going round or going on about this. One area that we are doing and working on is with the NIH Inform Consortium. We are supporting a project where they are looking at co-infection of HIV and COVID, both in South Africa and Nigeria. The data that have already been captured are being visualized within a Reveal dashboard. So that's about as close as we have gotten to supporting an HIV use case. But again, I see this as a real opportunity for community-based care and treatment.
Great, thank you. I see we are actually running up quite close to the top of the hour. So I just want to sort of reiterate, thank you all of you who joined us today. Please do share the recording and the slides with any colleagues who weren't able to join us. And please do remember to reach out directly to the Akros team using those contact details that were provided if you do want to find out more and get sort of more detailed information. And on that note, I am going to hand back to Maria, who's going to wrap things up for us.
Thanks, Linda. Thank you, everyone. To reiterate, we're very grateful for everyone who joined us to see this first in a new series. And a big thank you, of course, to all of our presenters. And you all did a great job. It was a very interesting and engaging presentation. So thank you for being our guinea pigs and knocking it out of the park. We will be sharing the slides and the recordings. And we also have our second in the series, Taylor Downs from OpenFN. We'll be doing a case study on a security. So we're hoping that you join us. Please be on the lookout for the invite link to that going through our social media pages. And I think that's just about it. Thank you again so much for joining us. Thanks, everyone.
Thanks all at Digital Square. We appreciate the opportunity.
Oh, yeah.
Yeah.
Our pleasure.
Thanks,
Bye.
Thanks, everyone. Bye for now.